folks. My name is Frank Boyce. I live in Port St. Lucie, Florida. Over the past years, quite a few years, I've had issues with my back. There was never a doctor that ever went through any procedure to find out what really was involved with my back. Dr. John Robinson indicated to me that it was nothing but a schwannoma. Well, what the heck is a schwannoma? It is a benign tumor, and the thing was inside my spine, creating pressure on the nerves. So the only way to do it was a thing called cyberknife or surgery. The doctor recommended no surgery because he said as long as I'm standing and talking, he didn't want to do it because as good as he was, he could easily put me in a wheelchair. So after the cyberknife, about a year and a half, 2 years later, started getting more pain, and called Dr. Robinson. Through about 2 or 3 months of going through oxycodone and whatever I had to do with them, doing epidurals, facets, rhizotomies, and I asked the nurse, what about Florida medical marijuana? Her answer was, gee, I'm glad you asked because we're not allowed to bring it up, but Dr. Sidney Schwartz will come in and talk to you about it. So Dr. Schwartz came on over, sat in the corner and says, well, yeah, I've got an office and a practice and we'll see if we can find something that would qualify for you. So that's how I wound up with American Wellness. So I came down here to Stewart and filled out the paperwork and started the process, and it's been an amazing journey because it was always vapor products. I never really smoked much of anything. Oh, I love cigarettes. I was up to 4 packs a day. But I never really did anything with marijuana because it was always for the hippies. And I was a airline captain. I couldn't even go anywhere near this stuff. So I waited till I retired, and now I'm gonna let my hair grow. I'm gonna smoke my weed, and I could care less with hair lips the Pope. So that's what I'm doing. I come back and forth. You guys at American Wellness have helped me out. I've complained about some of the pricing and stuff, but being I'm a repeat customer and able to work deals out with Debbie here, and I also was able to get off of the oxycodones and get a release from that. Turned it into American Wellness, and it changed my schedule of required appointments to run them on out further. So that's been a big help financially. So the medical marijuana, the smoking side of it, has worked probably the best for me. It doesn't seem to bother my throat as much. I don't seem to cough as much. The vapes, the jury's still out on that. If I take some of these hits on these vapes, I can just roll around on the floor and just cough and cough and cough. Does it work? I don't know. The smoking does. My problem is that it really doesn't show up. Equate it to Long Island iced tea. Drink 3 or 4 and then stand up, see if you can navigate your way back to the bar. It doesn't work that way. Same thing with the marijuana. I'll sit down here and it's really good watching TV, and then I'll get up and go, well, where's the door? And it doesn't, and it relieves the pressure, the anxiety, whatever. It just works. So
it's helped you get back to somewhat of a normal lifestyle?
Oh, big time. Yeah. I mean, it has been, old time phraseology is better than high button shoes. It just really is a good deal. The big problem that I have with smoking the marijuana, the flower, or whatever you want to call it, is I make up a list of what works. That's all well and good. Bring it back and you can't duplicate it. So being it's something that they grow out there in the middle of East Behunga, it just is not always available, where a lot of the vapes are repeatable and things like that. So that's the only issue I really have. And then the other issue is trying to figure out how much of it to smoke. Nobody really tells you. American Wellness, Dr. Turner, he recommends a recommendation that he comes up with, and it's up to me to figure out. I got so much that I can use and figure it out from there. But the people in the dispensaries usually the young kids in there, and I say that because of my age, they seem to just know what to use, and it generally works out pretty good. So it took a while for me to understand that the state of Florida, that the doctors were giving you a recommendation and not a prescription. Yeah, it was because everybody lived with scripts all their life, and you got something, you went down, that's what you got. This here, they recommend you do this, whether it's vapor or flour or edibles or whatever you're allowed to legally take, and you just kind of on your own till you get it figured out. And I think I have it pretty well figured out. So it's all good now. I'm very pleased.
So were you trying to, what was your ultimate goal? Were you trying to get off the opiates?
I was trying to get rid of the pain.
Okay.
And, and
avoid surgery, or?
Well, the surgery was impossible for me. At least that's what they're saying. And I gotta have the respect for the doctors to say that, because a lot of them just knife happy and want to cut on you. But yeah, they just basically say that suck it up, buckwheat. It's just so your choice is, they're going to give you oxy like it's candy. They give me 60 at a time, 10 325s. The script read, take 2 a day as needed or more for pain. I never really took over 2 a day, but when I did, I had issues with that, and wound up with surgery that I didn't really need. And so I was able to get off of the oxy, and I feel 200% better for it. The flour, as much as I'd like to say that it puts me to sleep at night, really doesn't, unless I stay up to 2 o'clock in the morning and I keep on, go through, 5 or 6 joints, then you really don't care. So that's the problem that I have with it. But I think it's great. And hopefully, my opinion is, if it goes recreational, I'll never get rid of my medical card, because to me, it's the only way I can track what I'm supposed to have as good flour. You buy the stuff off the street all day long, but Engelbert Humperdinck standing on the corner is not where, or the Greyhound bus station where you buy your weed or your vapes. It just is not a good idea,
True. So let me ask you just one last question then. So here at Americann Wellness, what suggestions can you give us to improve?
My suggestion is that the doctors should be able to get toward the script side of it and say, okay, Frank, we're going to give you 5,000 milligrams for the month or whatever, which is, if I took that much, I'd be crawling all over the place. But what we give you, we would like you to try such and such a strain, whether it's indica, hybrid. Most of the stuff that you buy is hybrids. You can get sativas every now and then, you can get indicas. The other thing with the indica, it's for sleepy time or in the couch, whatever you want to call it. I don't feel like going out on the patio at 10, 11 o'clock at night and lighting that stuff up to put me to sleep. So I'm done usually smoking this stuff by 8 o'clock at night, if that. And I go to bed and I take what I take. I mean, it's just, some nights, last night I didn't sleep at all. The night before, I didn't wake up till 9 o'clock in the morning. So
wow,
there's no rhyme or reason why, it's just my nature makeup, I guess. I don't know.
Yeah.
But I have a neurologist, I have a medical marijuana doctor, I have a neurosurgeon, and then just for the heck of it, they throw in a general practitioner. He's cool.
There you go.
And nobody wants really to accept yet that you use the marijuana, because they cannot not treat you. They can't explain something that they're not licensed to do. So my general practitioner, he says,